Infection control is a critical aspect of healthcare and other settings where there is a risk of spreading germs and bacteria. Disinfection and sterilization are two important procedures used in infection control to reduce the risk of infection. Both involve the use of chemicals or physical methods to kill or remove microorganisms, but there are important differences between the two. And that is the topic of this video. So if you're ready, let's get into it. Disinfection refers to the process of using chemicals or physical methods to kill or remove most or all of the harmful microorganisms from a surface or object. Disinfectants are typically used on objects that come into contact with people, such as countertops, door handles, floors, stethoscopes, pulse oximeters, blood pressure cuffs, and ventilator surfaces. Common methods of disinfection include pasteurization, alcohol solutions, iodine solutions, and glutaraldehyde for high-level disinfection. It's important to note that disinfection is generally considered to be less effective than sterilization, as it may not kill all types of microorganisms, including some resistant strains of bacteria. Sterilization, on the other hand, is the process of using chemicals or physical methods to kill or remove all microorganisms, including viruses, fungi, and bacterial spores. Sterilization is required for all reusable invasive medical equipment, such as surgical instruments, intravascular catheters, heart and lung bypass components, dialysis components, and bronchoscopes. Common sterilization methods include steam autoclave, dry heat, ethylene oxide gas, and glutaraldehyde solutions. Again, sterilization is considered to be a more effective method as it does kill all microorganisms, including resistant strains of bacteria. It's also important to note that in most cases, surfaces and objects in healthcare settings are first cleaned to remove dirt and debris, then disinfected or sterilized. Cleaning is an important step in infection control as it removes visible dirt and debris that can harbor microorganisms. Then disinfection or sterilization is performed depending on the requirement of the object or surface in question. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you'll enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.